Hello there, my friend. I'm Dr. Richard Miller. If you've clicked on this video, I suspect that little number on your blood pressure cuff stopped you cold this morning. Maybe it was higher than it should be, maybe it's been creeping up for months, or maybe you're simply tired of feeling like your own body is running away from you. I sit across from folks just like you every single day, good, honest people in their 60s, 70s, and beyond who tell me, Doc, I feel pretty decent, but these numbers keep climbing. They look at me with that quiet worry in their eyes. The kind that says they're afraid of losing the independence they've worked so hard for. Let me start with the most important thing I can tell you today. High blood pressure is not a life sentence. It's not a verdict. It's simply your body trying to get your attention. And today we're going to listen to what it's saying and, more importantly, learn how to answer it in a language your body understands. I've been a doctor long enough to know that most people think the only real answer is medication. And yes, there are times when medication is necessary and even life-saving. I prescribe it when I have to, but what I've learned after years of treating thousands of seniors is that we have been overlooking something far more powerful, the quiet, consistent habits that shape our health every single morning. There's one small shift in how you begin your day that can dramatically change the pressure inside your arteries. I'm going to walk you through it step by step, but first let's talk plainly about why this is happening to so many of us as we get older. Picture the blood vessels in your body as the plumbing system of an old but well-loved house. When the house was new, those pipes were supple and flexible. They could stretch and relax with every heartbeat. But over the decades, a little wear and tear sets in. The walls get a bit thicker, a bit stiffer. They don't expand quite as easily as they once did. So when your heart pumps, it has to push hard. That increased force is what we call hypertension. It's not usually one single thing. It's the slow accumulation of years of tension, poor sleep, dehydration, and a nervous system that never quite gets the chance to rest. Here's what most people get wrong. They think one hard workout at the gym or one pill in the morning should be enough to fix years of habits, but your body doesn't keep score by the week. It keeps score by the minute, by the hour, by the steady rhythm of your days. The real culprit for many of my patients is that their nervous system is stuck in what we call the sympathetic fight or flight mode. It's as if your body is still running from a saber-toothed tiger even while you're sitting in your favorite chair drinking coffee. That constant low-grade alarm keeps your arteries tightened and your pressure elevated. Over time, those stiff vessels get damaged, and that damage is what leads to bigger problems down the road. I want to tell you about a patient I'll never forget. His name was Harold, 72 years old, retired engineer, sharp as a tack. He came to me on 4 different blood pressure medications, and his readings were still running high. He was doing everything right on paper, yet his body refused to cooperate. When I asked him to walk me through the very first hour of his day, the truth came out. Harold was waking up, rolling over, checking the news on his phone, drinking strong coffee on an empty stomach, and then rushing around the house with 100 little worries on his mind. His system was getting flooded with stress hormones before his feet even hit the floor. We didn't change his medications that day. We changed his morning. I asked him to try something that sounded almost too simple. Wake up, stay off the phone for the first 30 minutes, drink a full glass of room temperature water, sit by the window for 5 minutes of quiet breathing, then take a gentle walk around the block. 3 weeks later, Harold's average reading had dropped 12 points. 12 points. That's the difference between worrying about a stroke and sleeping peacefully at night. His face looked different too. The tension was gone. He told me he felt like he had his life back. That's why I want you to think about your own morning for a second. Be honest with yourself. What's the very first thing you do when your eyes open? Do you reach for the phone? Jump straight into chores, or do you give your body a chance to ease into the day? Drop a comment below and tell me. I read every single one. When we get honest about where we are, that's when real change begins. Now let's talk about what actually works. Not theory, not fads, practical things you can start tomorrow that respect the reality of being a little older, maybe living with a few aches and pains and still wanting to enjoy your grandchildren in your garden. The first change is so simple. Most people dismiss it. Hydration, most of us wake up mildly dehydrated after 6 or 7 hours without fluids. When your blood volume is low, your vessels tighten up to maintain pressure. It's your body's smart but temporary fix. So before you touch coffee or tea, drink a generous glass of room temperature water, not ice cold. Room temperature slips into your system more gently. You can add a squeeze of lemon if you like the taste, but the real magic is in the volume and the timing. Do this every single morning and you're giving your cardiovascular system a head start instead of playing catch up all day. I've had patients tell me this one change alone lowered their morning spike by 8 or 9 points. It's not magic, it's biology. Your kidneys, your arteries, and your heart all work better when they're properly hydrated. Next comes movement, and I want to be very clear with you. You do not need to become a gym rat. The single most effective exercise for blood pressure in people over 60 is simply consistent, moderate walking. When you walk at a comfortable pace, the big muscles in your legs gently squeeze the veins, helping push blood back to the heart. At the same time, your blood vessels release nitric oxide, which acts like a natural relaxant. The vessels open up, pressure comes down. The key is rhythm and consistency, not intensity. 20 to 30 minutes where you can still talk, but you feel a little warmer than when you started. That's the sweet spot. Some of my patients walk in the morning, some after lunch, some in the early evening while the sun is going down. The important thing is that you do it nearly every day and at roughly the same time. Your nervous system loves predictable rhythms. It learns that after this walk comes a period of calm. The sympathetic alarm turns down. The parasympathetic rest and digest system gets stronger. If you have arthritis in your knees or hips, that's all right. Walk at your own pace. Maybe it's around the living room at first, maybe it's with a walker. The body doesn't care about speed, it cares about regular, gentle movement. I've seen people in their 80s drop their systolic pressure 30 points just by walking faithfully for 20 minutes a day. The pride in their voices when they tell me their new numbers is something I'll never get tired of hearing. Let's talk about something most doctors mention only in passing, the delicate dance between sodium and potassium. Yes, we need to be mindful of salt, especially the hidden salt in processed foods, but cutting salt is only half the story. Your body needs potassium to help the kidneys flush that sodium away. When potassium is low, sodium builds up and pressure rises. It's that simple. So instead of obsessing over every grain of salt, focus on adding beautiful potassium-rich foods, spinach, Swiss chard, sweet potatoes, avocados, bananas, beets, white beans. These aren't diet foods. They're powerful natural tools. One of my favorite suggestions is to keep a bag of baby spinach in the refrigerator and throw a couple handfuls into your lunch and dinner. Saute it with a little garlic, put it in an omelet, blend it into a smoothie, small choices that add up. I had a patient named Margaret who hated the taste of most healthy foods. She was 78 and stubborn as they come. We made a deal. She would try adding one new potassium-rich vegetable every week. She started with sweet potato mash with a little cinnamon. Then she discovered how good sauteed spinach tasted with eggs. 6 months later, she was off one of her blood pressure medications and laughing about how she used to think vegetables were punishment. That's the kind of victory I want for you. Now let's talk about the invisible driver behind so many stubborn cases of high blood pressure, chronic nervous system tension. I'm not going to insult you by saying just stop being stressed. That's unrealistic. Life still brings worries about adult children, health scares, money, and the state of the world. What I can teach you is a simple physiological tool that short-circuits the stress response before it gets baked into your blood pressure. I call it the exhale emphasis breath. When we're anxious, we take short, shallow breaths. That tells the heart to speed up. But when you inhale gently through the nose for about 4 seconds and then exhale slowly through the mouth for 8 seconds, something remarkable happens. Your heart rate slows, your blood vessels relax, and your brain gets a clear message: we are safe right now. Try it for 2 minutes before each meal. That's it. Before breakfast, before lunch, before dinner. 2 minutes of slow breathing. You can do it sitting at the kitchen table. I've had patients who were skeptical at first, but after a couple of weeks, they noticed their resting heart rate was lower, they were sleeping better, and their blood pressure readings were steadily improving. One gentleman told me it was the first time in 20 years his body felt like it wasn't at war with itself. There's another piece I want to spend a few minutes on because it matters more than most people realize: sleep. Poor sleep and high blood pressure are locked in a vicious cycle. When you don't sleep deeply, your body produces more stress hormones. Those hormones raise blood pressure, which makes it harder to sleep. Breaking that cycle is worth every effort. Create a wind-down ritual, dim the lights an hour before bed, put the phone in another room, maybe read something gentle or listen to soft music, keep the bedroom cool. These aren't luxuries, they're medicine. Many of my patients see their morning blood pressure numbers improve dramatically once they protect their sleep like the precious resource it is. I also want to speak directly to those of you who are already on medication. Some of you worry that if you start making these changes, your doctor will be upset. Let me reassure you, any good physician wants you healthier. When my patients lower their pressure through consistent habits, we often find we can reduce their medication. That means fewer side effects and more energy, but we never stop medication suddenly. We adjust it carefully and safely together. Your doctor is your partner, not your enemy. So how do we make all these changes stick when life gets busy or old habits come calling? This is where most people stumble, and it's where I spend the most time with my patients. The secret is to stop trying to become a completely different person overnight. That approach almost always fails. Instead, become someone who is consistent. Pick one single thing this week. Maybe it's just that morning glass of water. Do it every day without fail. Notice how you feel next week. Add the breathing practice before meals. The week after that, add the 20-minute walk. Stack the habits slowly, like building a sturdy house. Your body is remarkably forgiving. It remembers how to heal when you give it the right conditions day after. I've seen it hundreds of times. People who thought they were stuck on medication forever are now celebrating lower numbers and more energy. One of my favorite patients, a retired school teacher named Evelyn, started with just the morning water and breathing. A year later, she was walking 2 miles a day, eating those potassium-rich foods she once ignored, and had reduced her medication by half. She told me she felt younger at 76 than she had at 66. That's not marketing talk. That's the power of steady, gentle change. Your blood pressure is not measuring your worth. It's measuring how your body is responding to the life you've been living. And the beautiful thing is you can change that response. Every glass of water, every mindful breath, every steady walk is a love letter to your future self. You're not just chasing a lower number on a machine, you're protecting your ability to play with your grandchildren, to travel, to garden, to sit on the porch with your spouse and watch the sunset without worrying what the next doctor visit will bring. This is a journey, not a sprint. Some days will be better than others. That's normal. What matters is that you keep returning to these simple practices. Your arteries can regain flexibility. Your nervous system can learn to rest again. Your kidneys can find their natural. I've watched it happen in people who once felt completely defeated. So I'm asking you to begin tomorrow. Pick one thing, just one. Maybe it's the water, maybe it's the breathing, maybe it's putting the phone in another room when you wake up so the first voice you hear isn't the morning news but your own calm thoughts. I'd love to hear from you in the comments. Which of these steps feels doable for you right now? Have you already discovered a small change that made a surprising difference in your blood pressure or energy? Share your story. You never know who might be sitting at their kitchen table feeling hopeless and needing exactly the encouragement in your words. If this video gave you practical hope and clear steps you can actually use, please take 2 seconds to hit the like button. It helps these messages reach more people who are quietly struggling with the same numbers you were. Thank you for spending this time with me. I don't take your trust lightly. I know there are 100 videos you could have watched instead. The fact that you stayed until the end tells me you're serious about feeling better. Stay consistent, my friend. Stay curious about what your body is asking for. And remember that it's never too late to write a new chapter in your health story. Your future self, the one who still has the energy to do the things that matter most, is quietly cheering you on. I'll see you in the next video. Until then, breathe easy, walk gently, and know that real healing is possible. Take care.